Hey everyone, welcome back to another video. In today's video, we're going to be speaking about what Canada is doing at this present moment. So Canada is presently calling all doctors and nurses to relocate to Canada. Now, if this is something that you're interested in and you want to know what are they doing right now for nurses and doctors to come to Canada, stay tuned in this video and listen to Empowered RN. So hey guys, welcome back. If you're new here, welcome to Empowered RN, where we share news globally, anything that's happening across the world in terms of opportunities, in terms of movement, healthcare workers, jobs. Empowered RN is your girl and we're sharing that today. So before we jump into the video, we have a bit of housekeeping to do. Thank you guys for watching. Thank you guys for staying tuned, on my faithful subscribers, everyone that has been listening and streaming, whether you're on TikTok, Instagram, or YouTube. Housekeeping matters. Let us big up our faithful community right now. So if you constantly reach out, comment, press that like button, it gives a highlight in my YouTube studio of these community members, and I'm going to shout them out right now. So first at the top is Vibing with VC. Big up yourself, Vibing with VC. We see you touring Colombia and presently now in New York. So if you're interested in Jamaican content, you can reach out to her. Big up to the Quirky Club girl. Some of you guys don't have YouTube pages, but if you do, let me know and I can come over, follow you, watch your content, and if you want to collaborate, we can partner, anything you name it. Big up to Think Nursing channel. She also speaks about international nurses and nurse practitioners. She's also from Jamaica. Also, big up to Crafts by QLLC. Big up yourself. She is also a nurse and she does a lot of crafts. If you're interested in learning how to make journals, how to make anything arts and craft, even just a shirt with logos or anything, hit her up on YouTube. She's on YouTube. And last but not least, Camille Marston. Now, I said some of you guys don't have YouTube channels. If you do, reach out to me. I'd like to subscribe, follow, and share your content. All right, so we're going to get into the meat of the matter. So as stated before, Canada is calling doctors and nurses. Specifically, let's clear the air. They are calling US nurses and doctors. But why is Canada doing this all of a sudden? So Empowered RN is going down into an article that was written by Andrew Kurjata. This was published on March 11, 2025, and we have another one that was recently published that I'm going to utilize. Now, you know that Canada is made up of different provinces. So one province so far is calling US doctors and nurses to come and work in Canada. This is British Columbia, and the article states, I'm going to have it up here, British Columbia aims to poach US doctors and nurses, highlighting based on the uncertainty that is happening at the border. Now, it further reads that British Columbia has turned its eye towards luring doctors and nurses from the United States to move into what the health minister, Josie Osborne, is calling unprecedented recruitment opportunity. Osborne says that the province is changing its licensing rules so US trained doctors can begin practicing in British Columbia right away without any further assessment, exams, or training. She said that there will be a similar scale back of the barriers facing US trained nurses and that a marketing campaign will be unveiled in Washington. So these are the states that they're going to be pushing recruitment to in the United States. Washington, Oregon, California within the next few months. Now, they're speaking with regards to uncertainty that's happening in the US. They're making it their priority to target recruitment campaigns and an opportunity to attract skilled healthcare workers interested in moving to Canada. She's saying that this provides an opportunity for British Columbia to send a clear message to doctors and nurses who are working within the United States. They're saying, now is the time to come to British Columbia. We will welcome you to our beautiful province where together we can strengthen public health care and build healthy communities. She's also noting that the province will also promote opportunities in rural and remote communities facing shortage of healthcare workers. Great time, she lamented, for people to consider moving to a place where they feel supported, where they feel welcomed, and where they know that they're going to have the kind of colleagues beside them to support them in the work. The province states that the recruitment campaign will build on the success of recent changes made to the payment model for family doctors, first put in place in February 2023. Since then, Osborne says 1,001 family doctors have started practicing in British Columbia, with a record number of residents of 250,000 attached to a primary care provider in 2024. So that was the first article that was speaking to British Columbia, and they are inviting nurses and doctors specifically in the United States to come on over to come to Canada and work in Canada. So they're poaching the nurses and doctors, and they listed the states that they're going to be looking at. They're looking at Washington, they're looking at California, and also looking at Oregon. So Osborne further stated that American nurses will soon be able to apply for licensure directly with Columbia College of Nurses, which would then review their education, registration, and regulatory history in the United States National Nurse Licensure and Disciplinary Database. Now, there are some challenges that the article spoke about, that there are about 400,000 people still waiting to be matched by a family doctor in Canada, in British Columbia right now, underscoring the need for more help even with the recent success. Now, the president of the British Columbia Nurses Union said that there are about 6,000 nursing vacancies across British Columbia. Let me read that again. British Columbia Nurses Union President Adrienne Gare said that there are about 6,000 nursing vacancies across British Columbia, and highlighted the need to improve working conditions for those who are already doing the job. So this is one article that we spoke about. Now we have another article that is speaking with regards to another province that is jumping on a recruitment campaign to get US nurses and doctors into Canada. So this article was written by Colin Stringer. So in this other article, it states that Ontario to allow US health workers to begin working immediately. This was written by Colin Singer in June 6, 2025. So Mr. Singer in his article stated that Ontario is taking bold steps to address its healthcare workforce crisis by allowing qualified doctors and nurses licensed in the United States to begin working in the province without first registering with a professional college. The new policy removes a key barrier that has delayed access to trained international talent, while still requiring compliance with Canada's immigration and work permit rules. The move comes as healthcare worker shortages continues across the province, and as more American professionals explore opportunities internationally in light of various political uncertainty. Now, the new rules for US licensed health professionals. So if you're a US nurse watching this, or you have a license in the US already, they're stating that under this policy, board certified physician, not only nurses, doctors also, licensed nurses from the United States, including nurse practitioners, registered nurses, and registered practical nurses, can begin working in Ontario immediately. That means immediately as you land. You can start working for a period up to 6 months while they complete their registration with the Colleges of Physicians and Surgeons of Ontario or the College of Nurses of Ontario. Now, they're saying that these healthcare workers must be licensed in their home jurisdiction with no record of misconduct or incompetence. They will still need to go through the standard federal processes to obtain work permits or even a permanent residence. By cutting that red tape that is delaying highly trained US doctors and nurses from being able to live and work in Ontario, we are making bold strides to ensure Ontario patients receive timely and accessible care. And that was said by the Deputy Premier and Prime Minister of Health, Sylvia Jones. No, I think they're making these settings or the policies even broader because the government is also removing existing restrictions that previously limited US trained physicians and nurses. And not only them, they're also removing restrictions for respiratory therapists and medical technologists to work in public health hospitals and long-term care homes. So they're opening up to make it more broader and for professionals to work in primary care clinics, home and community care settings, and community laboratories. What they're doing with this policy is that they're stating that they aim to make it more quickly to add trained professionals to the front lines. They want to also improve access to primary and community-based care. They want to make sure that they ease pressure on hospitals and emergency departments, support long-term staffing in undeserved areas. At the same time, Ontario is going to continue to invest in its local and healthcare pipeline through various measures. Now, the policy they stated have received widespread support. The policy has received support from various healthcare organizations all across Canada with regards to this. And that's the end of the article. So by reading this article, we saw that 2 articles presented spoke that Canada is increasing recruitment for various nurses, healthcare professionals, doctors, respiratory therapists, medical technologists, all across America to come to Canada and work. 2 provinces that are making policy changes to make it they work immediately once they enter includes that of Ontario and British Columbia. Now, Canada, I may say in this, let's assess the article. It's a bit smart. I'm not saying you guys were not smart before, but with all that is happening right now, they're utilizing their recruitment machine to poach nurses and doctors to come on over. We're right beside you. Come on over and work for us. Nothing is wrong with that because they have a shortage and they have a need. But what Canada also needs to make sure that if you're encouraging nurses, doctors, and various healthcare professionals to come on over to work, make sure that you have livable wages. Make sure cost of living is something that people will be satisfied with. Make sure that the pay that nurses, doctors don't complain, but if you complain, we don't hear, but I can speak for the nurses. Pay. We always hear about nurses' pay. Make sure that if the nurses are coming over, that you have pay structures for them that is competitive and appealing. Because we all know there are times when many Canadian nurses actually leave Canada and go over to the US in terms of better pay and opportunities. But it depends on what that nurse or healthcare worker is looking for. As I always tell persons that countries that I normally look at and study in terms of migration, their policies, healthcare, workforce, and all of that, if the country gives you a lot of benefits, you won't receive a high pay because your benefits will max out that pay, right? If you have free education, free healthcare, you can't expect to have high pay. But if you live in another country that doesn't have free healthcare, no free education, but you have a high pay, it maxes out and that's why I say it depends on what the healthcare worker is looking for. But at the same time, I implore Canada and the officials, if you're watching this, make sure cost of living is good. Make sure that you have good housing. Make sure there are livable wages and people can actually survive. But I like the machine that they're using, and they're being smart with this right now, encouraging persons to come over. But we also make sure that when persons come over, that they're not when persons actually come over, it's something that is going to be satisfactory to them and beneficial to them based on where they're coming from. Now, I like to be fair. And I'm going to say that. So I went online and I saw the articles. Couple persons commented, and I like to see the comments. And 2 persons commented that were actually living in Canada, and they say, "I love it here, guys, but the pay isn't all that." So something that you guys need to think about. And somebody says, be careful because you may be, somebody also noted in the comment section that be careful that you may have a good amount of pay, but you also have to remember the taxes that you'll have to pay also. So that's 2 comments that I looked at, and I said those were eye-openers for persons. But a lot of persons, if you're leaving from your country globally elsewhere, it's still a good opportunity in terms of education and also healthcare with regards to that. But Canada, I like this move in terms of poaching or bringing for US nurses and doctors. And as a former international nurse and still an international nurse, right? If we're making changes for other persons to come over and inviting them, make those changes also for your international nurses also, right? I believe in that too. And I'm not saying that they're not doing this, because recently some provinces made massive changes in that they made lessen the regulatory requirements in terms of international facing long wait times. They eradicated some of the red tape that international nurses had to face. Persons were waiting 2, 3, 4 years. And I must commend some of the provinces that are doing that. And I saw where some of the provinces stated that they had to pause some of their international nurse recruitment due to the fact that they over exceeded or oversubscribed in the amount of persons who had applied. And I think one province noted that about 30,000 applications were received from international nurses. So I won't bash them too much, but also look at other provinces and make sure that you make it easier too for other international nurses to come, and those that are already there. And we're not saying that you're going to decrease it any shape at all. No, we have to remember public safety, and we also have to make sure that individuals that are coming, that their education matches their standard. And I think why Canada and US will do well with this is also because their education and their licensing requirements are quite similar. Nurses also from Canada take the NCLEX, and nurses in the US uses the NCLEX, so it's much easier to transition. Alright guys, so let me know in the comment section how you liked this video. Do you think that the changes that Canada is making right now with regards to getting nurses from USA and doctors to come to Canada, do you think it's one that will bring success? I think actually people will gravitate to it. Let us know in the comment section. And if you stayed right now from the beginning till now and watch this video, thank you so much. Stay tuned as we see you in the next video. Bye.